one of the things I feel that we should do as a physician is also always give the patient a choice in making a decision for themselves, for their own lives. And people with chronic illnesses, where, you and I, as relatively healthy people, or not having that illness, it's difficult for us to understand the pain and the discomfort that the patients have to go through on a daily basis, and the effect of it on their quality of life, and the discomfort that they have to face with, feeling drowning in secretions and other things. So I think some shared decision making should be considered at every visit. And I'll give you a personal example. I live in Oregon, which is a right to die state. And one of the things, and I'm not an expert on right to die laws in other parts of the country, is that if you feel like that you have enough physician, and physicians agree that you have less than 6 months to live, and you want a physician-assisted suicide, and you're going to take a lethal dose of an opiate, you have to be able to take it yourself with a spoon. I or your family member cannot give it to you. So that becomes a problem, and that's why it's important to bring it up at every visit, a shared decision making, because I distinctly remember a case a few years back where I had this very high flying executive, and he wanted everything done, and we were respecting his wishes. And then a point of time came where he felt like that maybe, and a medically assisted death was the best possible outcome for him. But he had at that point of time become so weak that we could not help him with that. He eventually ended up transitioning to hospice care and passed away very peacefully. But from my perspective, the reason I bring this whole story up is to let people make that decision for themselves and be in control of the choices in their life. Our job as providers is to provide options to people and choices, and help them get the care they need and respect their wishes.